This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, so hi guys, my name is Simran Gill. I'm one of the PGY4 chief residents of SUNY Downstate. Nice to meet all of you guys. So I'm going to talk about my program here. There we go. So just an overview. The PM&R at SUNY Downstate Health Sciences University, we're providing high quality care to a diverse patient population, especially in Brooklyn, right? To the training of skilled physiatrists, we're capable of providing excellent care to patients with a wide range of impairments. So there's a lot on the slide, but I just want to go over it. I'll give you a little background. I'm actually Canadian, so I came to SUNY Downstate. It's a whole new experience for me, coming from Canada to New York and just America in general. But it's true, and there's no place like Brooklyn. I gotta brag. But just some little factoids about Brooklyn. It's 2.3 million people, an entire world within walking distance, so it makes SUNY Downstate an ideal place to study and train. It's essentially in I would say kind of like the heart of Brooklyn, and it's really accessible by train. A neighborhood is Flatbush isn't just a backdrop. You spend time there, the patients you'll serve, the community organizations you work with. It's so diverse, and it's such a great and integral part of learning and making you a better physiatrist throughout the years. Brooklyn's like the third largest city of all the boroughs. If they're a city, basically Brooklyn would be the third largest. It's a lot of people packed into the city. But it's not just the sheer size; it's what's in Brooklyn. So a couple of things there's a number of different ethnic and racial groups live here. 30% share of the population is foreign-born or immigrant. 46% of the population speaks the first language other than English, and 66 plus number of neighborhoods in Brooklyn, many of which are home to distinct ethnic populations. So what SUNY Downstate is it's an academic medical center in the heart of Brooklyn, right? We're dedicated to basically urban and immigrant health, and if you live here, you be challenged by many people in those different groups. They aren't just abstract concepts. Not when you read a test question or even an article, you actually see it firsthand of all the different kinds of groups and people and cultures you experience here. It makes you a stronger physician, in my opinion. It makes you a stronger physiatrist, so you kind of understand the community that you grow in. So it's a good experience for our residents when they come here, because you have residents from different places, from America to Egypt to Canada, like myself. So it's nice kind of becoming part of this really awesome community. So what sets Downstate apart? So our mission is to provide outstanding education to physicians, scientists, nurses, and other healthcare professionals. We advance knowledge of cutting-edge research and translate it into practice, right? And we care for and improve the lives of our globally diverse community. Basically, SUNY Downstate will be nationally recognized for improving people's health by providing excellent education for healthcare professionals, advancing research in biomedical science, healthcare, public health, and delivering the highest quality of care. So the values we do, we value pride, professionalism, respect, innovation, diversity, and excellence. You'll see a couple pictures here. I'll just point to where you see me. I'm always here in the little corner here. But these is our resident class here. This is our PGY 4 3s and 2s from last year. This is a nice welcome dinner that we always have for our PGY 2s and our staff. But the world has been coming to Brooklyn for generations. 40% of people who live here from different countries, and now it's 2.3 million residents. It's the largest borough in New York City. You're in, like I said before, you're in the middle of Brooklyn. You get so much access to experience. It's the experience from the patient care to just the community itself, the food even, all the hole in the walls, all the bacon, egg, and cheeses, which I never knew about until I got here. And now I can't stop getting that and chopped cheese. You'll get the best in Brooklyn. This is just saying that it's the HGMA accreditation status of PM&R Residency program with commendations or no citations. Diversity, inclusion, and equity. So I'm actually the president of the DEI PM&R committee. So we do, we're proud of what we kind of accomplish in terms of bringing awareness of different kinds of things that we see as physiatrists, whether it's within our community, whether it's in the hospital, whether it's just within our rehab centers itself. So we seek to make all of our faculty, staff, and trainees aware of the healthcare inequities present both nationally and locally. Our division seeks to find ways to overcome these systemic barriers and provide high quality, fair, and equitable healthcare services for all. Resident wellness. So there's me again. This is an ice skating event we had. It was lots of fun. Cover residents. We just went out into the park that's nearby during the winter time. So we support our trainees' health and wellness. We usually do something every month. Whether I think last month was board games, and then we played like Kahoot, but not a Kahoot.
Oh, we lost your audio. Dr. Gill, we can't hear you right now. Oh no. Oh, there you are.
Hello, can you guys hear me now?
Hey, yes, there you are. I'm
so
sorry.
sorry.
We
Oh
missed
no.
part of that last slide.
Okay. I think my headset just like it's not dead, but okay. The last slide, right? The wellness
Yes,
one.
please.
Okay. Okay, this one.
Yes, thank
Okay.
you.
No worries. So yeah, apologies. All right. So what I was saying, the wellness was something that our program adjusted appropriately, I would say, because this is there's a picture of me here. This is an event we had with ice skating. And every month we usually organize some kind of event. Our program is supportive of anything we bring to the table. So when we say, hey, we wanted to kind of have a wellness event for the residents coming up for this day, and we were thinking of ice skating, they're like, okay, sure, yeah, we'll help pay for it, we'll help organize it. So for instance, next month, we're gonna do an escape room with residency class, and it's a good kind of collaboration that all of our residents have together to get to know each other and also just get some time to online. So okay, didactics are every Thursday from 1:30 to 5 p.m. They are protected time, and we go through a various amount of like different things we see in the curriculum. We usually use an 18-month curriculum, and we kind of follow like Cucurillo's chapters, which I'll go over soon what the actual curriculum entails. But it's a strong focus of our residency. We go through a lot of things like hands-on learning. We have people coming in to like different type of vendors to show us like different Botox or even like different like kind of advancements in the PM&R community. Journal club board reviews, we do mock exams, mock oral exams, even preparing as a P2 by 2 or 3 for board exams because studying starts early. That's what we kind of say. But we get exposed to at least different types of each topic we get exposed to is at least twice during the residency with the 18-month kind of curriculum that we have here, and it's essentially protected time 1:30 to 5 p.m. So if you have like inpatient admissions or you have some kind of orders and they get paged, right? We have the attendings that essentially cover you while you're getting your educational experience. We hold grand rounds usually once a month. Right, we reach out to different people. Like last one we had an aphasia grand rounds from one of our SLPs at the hospital. We also organize different kind of events at the simulation center, and we have many different kind of activities that we try to incorporate into our didactics. Here's some other kind of educational events we have here too. So we have like the medical student interest group, we have the sports medicine interest group. We kind of reach out to our medical students in SUNY Downstate, whether they're under PM&R or not, and even the other residents or interns who are interested in the field. They kind of have them come out here and show them what EMGs are about, or what physiatry is even all about, right? So yeah, here's just a kind of overview of like the modules. I was saying it's like an 18-month curriculum. We go through all the rheumatology, prosthetics, stroke, brain injury. So we kind of cover all of these modalities. This is like a little tournament, like rehab bowl, we call it, that New York kind of does, the New York Study PM&R, where all the different residencies go and try to compete to answer questions. Like really tough board questions. Whoever wins this giant trophy. So we won it 2 years ago. We didn't win it last year, unfortunately, but we're gonna go for it this year. And then so we have our own little mini trophies to kind of do that when we have like a little bit of like a little mini competition, but the winners get these trophies saying, "Hey, you guys won the our little mini rehab bowl." So it gives them a little incentive. So what we kind of frequently do, we do the electromyography, nerve conduction studies, Botox injections, both for migraine and spasticity. We have like a neurologist at Downstate that kind of specializes in Botox injections for the migraines and spasticity, and then even we get some exposure to the Bronx VA, where we can do like ultrasound guided Botox, EMG guided Botox, especially for those patients who have like who have spasticity and like peripheral extremities. A lot of ultrasound guided diagnosis injections, or even just kind of regular injections, whether it's peripheral joint injections, steroid injections, Kenalog injections, even just regular like gel injections. And a lot of the fluoroscopy guided interventional spine procedures. So this is our unit here in the clinic. We basically have this, if you're rotating here with our program director, Dr. Agrawal, we do spine injections at least 2 to 3 times a month. He has a patient scheduled from in the morning, usually like 15 to 20 patients. So we get exposure to transforaminal epidural steroid injections, check nerve blocks, epidural, like lumbar epidural steroid injections and everything. So, and also like, we have these learning sessions here. We call them KIP sessions. So every morning, when you're on this rotation, you basically we have the opportunity to practice to get better and better every time. These are different kind of things we do, like ultrasound workshops and neurocognitive EMG workshop. We always get together to try to learn to get better, get more exposure, whether you're from PGY2 to PGY4, because the more you do it, the better you get. Just as saying, evaluation process of residents every monthly rotation site, we meet 1-to-1. With the attendings we give really good feedback. They tell you what you need to improve on, whether you're too medicine focused or you're not rehab focused enough, or work on your.
Oh, we lost your audio again.
Happening.
There you are.
Oh, sorry, I'm not sure why it's cutting off, but I caught it this time. Let me just plug this in 1 second. Okay, hopefully this stays. All right. And then your evaluations, they're available for you to review. So that they was saying that the attendings kind of talk to you one-on-one, give you the good feedback. And most of our attendings are pretty honor this pretty well. They actually take the time to be like, hey, listen, you need to work on this, or they tell you, hey, you're doing a really good job. This is a lot of this slide, but essentially we have basically like a lot of these resources available at SUNY Downstate with a simulation center. So we can book this, for example, when we go for when we do our ultrasound workshops. We have availability of like a bunch of ultrasound machines at SUNY Downstate that we can use during our didactics to learn about different peripheral joints, different things to scan, and we can even practice on these simulation mannequins as well. It's all available for us if we just take the time to book it. So what's a typical workday? So inpatient 8 to 5, right? We basically go in pre-round, you go round with attendings in the morning, medication changes, call consults, and a lot of it is actually getting interactive with the patients. So we have a SUNY Downstate Kings County have a really good gym, so you can go down and spend time with the patients and the therapists and see how they're doing at the gym. And outpatient is again 8 to 5. Typically, you can see we see a wide variety: general rehab, sports medicine. You have an EMG specific clinic, interventional pain, wheelchair and prosthetics clinic, which basically focus a lot on the musculoskeletal exam skills, pain clinic as well. So we have a lot of injections and procedures in this, especially for peripheral joint, which is kind of beneficial if you're interested in that kind of training. We have a mentorship program, so all the seniors are paired up with like a junior or intermediate resident, just to kind of help guide them for what their careers are, or what their career goals are and everything. These are just kind of going over the different things that the opportunities for us as residents. So I did a few of these. For instance, we have a MSK exam where we teach MS1s about like just the general anatomy and physical exam skills that we see. It's just their introduction to basic medical school. And then the 3rd month in, it's like, here's your exams, is your MSK exam. So we are involved with that. And we also help oversee 3rd and 4th year medical students in like the PR interest group and sports interest group based on the pictures before. We also started this a lot of sports coverage opportunities, which I get into too, like especially like with the New York City Marathon, which I did last year, was a wonderful opportunity, and high school football, Special Olympics, and rugby as well. Another couple of things that I did, and it's a BK swag program. It's like Brooklyn Scholars athletes with academic goals. It's just reaching out to the young kind of athletic high school, college kids who are interested in healthcare and they don't know exactly where to go from here. And we kind of show them that it's not just PM&R in general, but what the opportunities are available in Brooklyn and from SUNY Downstate as well. And that kind of goes into exploring health careers programs when like college kids who actually want to go into healthcare and actually take that step and come in, and we kind of help guide their learning going forward, what the goals are, and then have them like shadow us essentially. So it's pretty a lot of good opportunities for teaching and mentoring here.
Right. And you have 5 minutes remaining.
5 minutes, okay. So I'll go over. Hello. Okay, yeah. Okay, so I'll go over to each sites really briefly. This is SUNY Downstate, right? This is the hospital in Brooklyn. This is our program director. His name is Dr. Agrawal. A lot of specialties there. We have Dr. Chan and Dr. Chow. And then in our inpatient unit, we have Zineda, who has been there for many years. She's great. Dr. Prasad is our sports medicine program director, and Dr. Hisham is the pediatric orthopedic surgeon that we rotate with too. And Dr. Ansiska is the neurologist. He's the one who's specialized in Botox, but also neuromuscular medicine. So essentially, when you're in downstate, you have one inpatient resident and one consult resident. So the inpatient, you have like 18 to 12 beds. You kind of take care of with the attending. And when you're consult service, you kind of go on the hospital and basically essentially consulting for the other attending as well. You can involve yourself in the Botox injection there, and with Dr. Ansiska, he has his own clinic where he does muscular dystrophy and neuroradiology as well. The Parkside Clinic is basically where I was kind of going over the interventional spine and everything. So you have essentially PGY3s and 4s during there. We see pain, we see the injections, we see TBI, we see stroke follow-ups, we see sports medicine. That's where you see with Dr. Prasad, and then we have the Dr. Hisham with the pediatric orthopedic surgeon. So we get a lot of exposure at this clinic and a wide variety of fields of PM&R. Here's another thing with prosthetic and orthotics. This is Matt. He's one of our specialists here. He's great. He comes in and basically takes us to his lab and tells us how things are grown, how things are made. He's really an expert in his field, so we learn a lot from him. Call schedule is essentially it's in-house 24 hours. Depends on what site, but let's say when you're a PGY2, if you're rotating at SUNY Downstate, it's like 3 times a month. If you're at Kings County, for example, it's like 6 to 8 times a month. I think it's less and less as you go throughout the year. So for instance, PGY4, I have 1 call a month as I'm at Kings. It's a 24-hour shift with the next day off. No free for any clinic duties afterwards. These are just some facilities at SUNY Downstate as well. Just gonna go speed up a little bit. This is Kings County, so it's a hospital right across from SUNY Downstate. So when you're on call, you cover the inpatient bed at Kings County and at SUNY Downstate as well. This is the site director. His name is Dr. DePorto. There's Dr. Keithley and Dr. Mazzacani. There are other attendings. And Kings County is basically more of a 25. It's a bigger inpatient bed with 2 residents covering. So when one's on call, the other one's one could cover the whole unit by themselves, but with the attendings present, obviously. But you get a lot more exposure here at Kings County because it's a county hospital. So you get a lot of people coming in. For instance, I got a lot of spinal cord injury patients here. I got a lot of gunshot wound patients here. A lot of TBI patients here. Even though this is just a regular inpatient unit, the county gets exposed to a lot of different patient populations and different kind of severe injuries that we see here. Outpatient is similar kind of clinic settings before. There's usually 3 residents, and you get exposure to general rehab, MSK, neuro TBI, EMG every Wednesday, wheelchair clinic every Friday, or P&O and on the Mondays. This is just another picture of us doing Botox clinic when Disport came in, and we kind of had a little workshop with them. And again, like I said, kind of call you had 24 hours. You have more when you're in Kings County, but you have the day off afterwards. I would say it's around 7 to 8 when you're a PGY2. When you're a PGY3, it's 3 per month, and when you're PGY4, it's 1 per month. This is our Hospital St. John's. So this Dr. Alon and Dr. Morales are the attendings. This is more of a consult service. So there's usually 4 residents here. You come in and consult. They consult us about the patients who are there for bedside mobility, ICU mobility, functional evaluation, and disposition. And we also have a clinic associated there too, where we go afterwards and we do EMGs and again, same kind of clinics that we have in the MSK, neuroperipheral joint injections, prosthetics, orthotics. No call schedule, and St. John's is wonderful. I rollerbladed down the boardwalk to clinic the other day. It was great. Staten Island, great hospital. We also have inpatient exposure too. This is the Dr. Mensch, Dr. Zealous, and Dr. Weinberg, the faculty. It's basically an inpatient one. You have 2 residents there, 16 beds, similar kind of status as the Kings County and SUNY Downstate. You just don't overnight there. Oh, am I running out of time?
Yeah, I'm so sorry. I'm gonna have to cut you off here.
Okay. I'll just go. Let me give 1 minute. I'll just okay. We also have the VA at the Bronx at St. Albans. Great exposure there. Quick brief about the call schedule, or just the regular schedule. When you're PGY 2, you're really inpatient heavy for the first 10 months, and 2 months you have consults. PGY 3 is a little bit mixed. You have like 2 to 4 months of inpatient, and then the rest kind of outpatient clinic. And then as a PGY 4, you mainly do clinic, a lot more EMG, a lot more procedures as a 4. There's a sports medicine fellowship here. Multiple opportunities for research. We really kind of emphasize on that, and a lot of publication and presentations here. Sorry, it took a little too long there. I had a little issues there, but if there's any questions, you guys let me know. These are just opportunities of a public health availability that we're associated with at SUNY Downstate. For instance, like the Brooklyn Free Clinic, the student-run clinic. We have the Arthur Ashe Institute for Urban Health. So all these opportunities for getting global health and public health, especially at Downstate. And here's the contact information. If you have any questions, feel free. You can email me here at pmr.cheese@downstate.edu.